Hello everyone. So this video deals all about acute rheumatic fever. So we'll be talking about acute rheumatic fever for a meanwhile in this video. So what is acute rheumatic fever? So what is rheumatic? Rheumatic means it's associated to rheumatology. Rheumatology means all the joint component. Okay, joint component. Okay. Now acute rheumatic fever. Acute rheumatic fever. What's the presentation? So basically, what happens is there's history of sore throat. Now history of sore throat will be there, and after a history of sore throat, what happens is after some time, after about 4 weeks time, there is cardiac, not majorly cardiac manifestation. There'll be joint pain. Okay, joint pain, the migratory joint pain, and there can be certain um, component like nodules, subcutaneous nodules, or someone will present with dyspnea, palpitations, secondary to mitral regurgitation because of acute rheumatic fever, secondary to valvular dysfunction, mitral valvular dysfunction. So let's talk about acute rheumatic fever. So acute rheumatic fever is a multi-system disease resulting from autoimmune reaction to the infection with group A streptococcus. Okay, so there is group A beta hemolytic streptococcus, and against this infection, there's formation of antibodies. Now these antibodies, after about 4 weeks of time, will not recognize self antigens. Okay, so it will recognize self body tissues as antigens and will form autoantibodies against it, and it will destroy. The major component being involved is the cardiac valve. Okay, cardiac valve along with all the layers. So it might be involving the endocardium, myocardium, pericardium. Now it can lead to pancarditis. Okay, so it's a non-suppurative complications of group A streptococcus infection. Usually secondary to group A streptococcus infection, sore throat will be talking about pharyngitis, laryngitis, or we'll be talking about pneumonias, right? So but over here, it's a non-suppurative complication. Many parts of the body may be affected, but the most important being heart. Okay, so rheumatic heart disease is often asked in your medicine exam. It's often asked in your pediatrics exam, so you have to be thorough with it. Okay, so it's usually common in someone where there is more crowding. Okay, overcrowding areas, low socioeconomic status. Okay, so it favors disease transmission of group A streptococcus. Okay, so more common in children 5 to 15 years. So 5 to 15 years of children, it's more common in 5 to 15 years of children, though can occur in any age. So it can occur in any age. Initial episodes is rare beyond 30 years. Okay, so the most important age group being 5 to 15 years, and there's no gender association. It's not said that there is no gender association, but rheumatic fever, it's more common to rheumatic heart disease is more common to females. Okay, untreated streptococcal pharyngitis up to 3% are followed by acute rheumatic fever during epidemics. Okay, so that is why any person who presents with sore throat must not be neglected. They must be treated well. So if they are treated well beforehand, before they even develop rheumatic heart disease, and this is known as a primary prevention. Primary prevention means you are intervening, you are giving treatment before the person develops features of rheumatic heart disease. Okay, now the pathogenesis is incompletely understood. The streptococcal pharyngeal infection clearly required. Okay, genetic susceptibility may be present. Molecular mimicry thought to play an important role in the initiation of the tissue injury. So it's basically the molecular mimicry. So the organism responsible is, there is responsibility of the streptococcus pyogenes. Okay, so there are certain serotypes like 1, 3, 5, 6, 14, 18, 19, 24, 27, and 29. So these are responsible for causing first of all rheumatic heart disease basically. Okay, now remember, the streptococcus pyogenes, they lead to pyoderma. Okay, they lead to pyoderma. So any patient who presents with a cardiac manifestation of rheumatic heart disease, just rule out whether 4 weeks prior to that disease, did they have some sort of crust in the maybe in the body, in the skin, right? And just rule out any kind of disease of the kidneys also. Just rule out hematuria also, okay? Remember, whenever we talk about, rheumatic heart disease, group epithelial like streptococcus, they might also lead to glomerulonephritis, most commonly post-streptococcus glomerulonephritis, okay? So just rule out both the disease condition, okay? So host factors, we already told you that it's associated with high overcrowding, and of course there's genetic susceptibility also, okay? Certain HLA genes has been implicated. Why these HLA genes? Remember, whenever we talk about autoimmune process, whether that be diabetes type 1 or whether that be celiac disease, like in the case of celiac disease, we have HLA-DQ2 and HLA-DQ8, okay? Here also we have HLA-DQ, isn't it? So see here, HLA-DQ, isn't it? So specifically in celiac disease, we have DQ2 and DQ8, okay? But in the case of rheumatic disease, in the case of maybe CTLA4 gene is also there, okay? And there is also HLA gene, HLA-DR2, HLA-DR3. So HLA-DR2, DR3 is associated with rheumatic arthritis also, right? 5, 6 is also there. So these all are, basically these HLA gene, it's basically known as human leukocyte antigen, okay? So they are responsible for rejection and acceptance, like they are associated with the MHC, that is major histocompatibility complex. So any kind of genetic correlations with these component will lead to molecular mimicry and will lead to autoimmune process, okay? Now it's basically the molecular mimicry which you should understand, okay? So in initial damage due to streptococcal invasion of the epithelial surface will with binding of M protein to type 4 collagen, allowing it to be immunogenic with subsequent activation of the host immune mechanism and tissue destruction. So basically, what they want to explain from these slides, whatever we have talked till now, that it's basically the immunomodulation. It's basically the immunomodulations that is associated with rheumatic heart disease, okay? Now we have certain component. Now see here. So group A streptococcus, they go for adhesion, right? They go for adhesion. There is invasion recognition by B cells, macrophages, MHC cells, activation of the T cells. Now these different antibodies, they go to different areas, right? So there is a criteria which is known as Jones criteria. JONS. J joint, O heart, N nodes, E is erythema multiformis, S is subcutaneous nodules, right? Now see here, it's basically the activation of the autoantibodies by these B cells, which is in turn being activated secondary to plasma cells. So epithelium, then comes to T cells, then goes to the lymphoid cells, then there is plasma cells, B cells, autoantibodies, right? So this is the sequelae, okay? So see here, always an antigen presenting cell will have class 2 MHC. If it's a 1 MHC is present in all the tissues except for your RBCs and sperm cells, okay? Because if it's present in RBC cells, you can never blood donate, and if it's present in your sperm cell, no one will be pregnant, okay? Now let's talk about the clinical features, okay? So clinical features is, there are two primary forms. Now we'll talk about clinical features in the next